Hello, everyone, and welcome back to the Parenting Village Unplugged podcast. I am very excited today because I have a very special guest who is going to be talking about all things dental health and especially dental health for our little ones as well. Now, have you ever wondered how you can best support your child's oral health? And what if supporting your child's oral health early could positively impact far more than just their smile? Now, today's conversation is one that I am really excited about because it touches on something that I feel is very overlooked in many families, and that is dental health and how dental health can actually impact our children's development and also their overall well-being. Now, we often think about teeth only when there's an issue, when there's a problem, when there's pain. And to put it simply, the mouth plays such an important role in feeding, sleep, speech, breathing, development, nervous system regulation, and so much more. And that is exactly what we are going to touch on today with the beautiful Maria Farrell, who we have today. And I'm so excited to have her here. She is a holistic dentist, a mum herself, and also the founder of a holistic dental practice right here in Australia. I'm so excited to have her on. I'm not going to share too much about her story. I'll let her dive into that for you guys. But her approach is very holistic, and that's exactly what I love about her. Maria, thank you so much for being here today. I'm very grateful to have you on the podcast and share all of your wisdom and your education. And the first question I have for you is, could you tell us a little bit about yourself, what you do, and the work that you do as well?
Yes, sure, Clarinda. First of all, thank you so much for having me here. I feel really, truly honored to be part of what you're doing and to be invited to participate on this journey with you. So thank you for inviting me. A little bit about myself. Yes, I graduated in Brazil and then I've been in Australia for the last 15 years. And I have had the privilege of being exposed to different professionals in the health sector and different mindsets, different cultures as well. So that gave me the opportunity to, through experiencing health issues inside my own family, to explore a little bit deeper our role in health, the role of dentist in health, and then I came to this wonderful realization that we can't segregate things. We are part of one body, one mind, one spirit. We can go on and on this, but just getting to what we're talking here today. Yeah, I love the fact that we are all connected, but also the empowerment that we get when we have a little bit of understanding of how our body works and the choices that we can make to influence our lives and the lives of the people that we love and that we can influence, especially our little ones, because yeah, we are blessed enough to participate and to contribute to their growth. So yeah, I really love the fact that we have to think beyond and how we can use the knowledge that we have to empower ourselves for better decisions. Yeah.
Yeah, beautiful. I love what you guys do. And like obviously dental health is so important. And we really work really closely with dentists. And obviously our blue book checks that we do as child and family health nurses really incorporates dental health. And I'm so excited to really dive into this topic with you because it's so important. And I really know that the role and effect it can have early on in our little one's life if we don't take care of our little one's teeth. So I'm really excited to dive into it a lot more with you. And I really would love for you to touch on your approach with your dental work. I know that what you do is very holistic, and you've already touched on that a little bit in your introduction. But could you, I guess, broaden that a little bit more? What does holistic dentistry actually mean to you, and especially looking at younger children as well?
So yes, when I started practicing holistically, I find that holistic sits under a certain umbrella that I started feeling a little bit limited because there's a lot of expectation when we use the word holistic. I like using more the word integrative. So now I've switched a little bit from holistic to integrative. Sometimes I use both because it's easier for people to understand what we do. But in fact, what that means is that we integrate our approach with what's happening in the mouth and how that connects with the whole body. When it comes to the materials we choose, to habits that we develop, to the bacteria, what the oral microbiome is doing in the mouth, and how that travels to other parts of the body. So whenever we think of something that's happening in the mouth, we are automatically thinking of how that integrates to the brain, to the nerve cells, to muscles, to gut health and everything else. So when I've decided to open the practice, I really did a deep research on which materials are more biocompatible, from fillings to cleans to implants to everything that we do. Because for me, Clarinda, I'm not sure how your approach is, but for me, like, it doesn't make sense to go to the supermarket and buy a container that's BPA free and then to place fillings inside my patient's mouth with BPAs. So we know that that's available, and it's really like, oh, I started feeling really conflicted with those things. So when I decided, okay, I'm going to open my practice, I'm going to work in the way that I believe and following my philosophy of life, I really did this deep dive because yeah, I know we know that the environment plays a massive role. And when I say environment, it's not just the external environment, but what we put internally. And so that was where everything started. And then digging further and further, we could see the influence of the oral microbiome and so on. So yeah, it's really the whole integration of the individual. It's a whole person approach.
Yeah, I love that. And obviously, you mentioned like what my approach is. Mine is very holistic too. When we're looking at children, we're not just looking at themselves, we're looking at everything that comes with that. So we're looking at their environment, we're looking at internal, external factors, we're looking at family, we're looking at the inside, the outside. And you
Mm.
have to when it comes to children, because everything within our little one's life, and same as dentistry, like obviously the BPA, like why would you use plastic containers and then or not use plastic containers but then use it when you're doing a filling, etc. You have to look at the whole picture when it comes to your little one's health, and it's so important. So I love that you've really adapted that in your practice, and I really appreciate that because it's something that I really do within my practice as a child and family health nurse as well. um, I would really love for you to really chat about dental health and why is it so important, especially in early childhood, from that zero years to 5 year bracket. Why is it so important?
Yeah, I love this question, Clarinda, because there is a lot of misconception around kids' oral health, and then a lot of parents come to us and they think that there is like an era with baby teeth and then adult teeth that are completely disconnected. But in fact, one, just for starters, habits are a big thing, and if we can influence our kids on having good habits since they were little, it's easier for them to keep those good habits when they're adults. So it's really educating them first on habits. What are they, how are they cleaning their teeth? How often are they doing it? What are the dietary choices that they have? So what's nutrition like and how often do they eat? And all those things. So that's one thing that's really, really important when we have this conversation with parents. I really like bringing that to the conversation because we know that that's the foundation. We're going to build that foundation for life. But not only that, a lot of people think that baby teeth will fall out, so we shouldn't worry too much about them or taking care of them or even restoring them when they decayed or when there's a problem with baby teeth. But we know that the baby teeth serve as a guide to the adult teeth. So sometimes parents come to us and say, "Oh, just have the tooth taken out because it's decayed," and we have the adult tooth coming through, right? But depending on the age, what happens is, imagine that someone had a broken arm and then there's plaster around, there's not a lot of movement, there's no function happening. We see that the muscles tend to shrink a little because of the lack of function. It's not being utilized. And the same thing happens with bone and gums. If we extract a tooth too early and the other tooth, the adult tooth, is not ready to come through, that bone and the whole structure collapses around that space. And then we don't have space for the adult tooth to come through. So we can't prematurely remove teeth because they're just the baby teeth. We can't overlook that because they do serve as a guide, as a path. But not only that, function. We see a lot of bullying nowadays, and kids have become very self-aware of their image as well. So there are lots of implications with that. But also when we look at, and I think that that's a lot to do with what you work with, also breathing and how those habits are and what's influencing nose breathing versus mouth breathing. So all those things need to be approached, all those things. So as soon as we see a kid walking in the practice, I'm already looking without even realizing. I'm looking how they're breathing, how is their posture, how is everything, because we know that there is that whole body effect on those habits. So yes, those are the things that we look the most. And one other thing that I know it's a little bit controversial, and I know that divided opinions on it, is what toothpaste, how much fluoride exposure we have, and all those things. So yeah, all these conversations are brought to the table. And the main reason why is because I want parents to be able to make educated decisions. If they decide to go with fluoride, okay, as long as it's an educated decision and not just a trend and not just pushed by old philosophies
Social
and
media.
yes, exactly. So education is the first thing that we focus on, but I hope I've answered your question.
Yeah, no, you definitely have answered my question about why dental health is so important in that early childhood. And it's because those baby teeth are really making the way for those adult teeth, and we need to look after the foundations first. Would you agree?
Yes.
That's
Oh, absolutely. You summarized it very well. Because you see, I'm passionate. I can go on and on here.
Yeah, no, I love it. Amazing. I think this really rolls on to the next topic that I really want to chat to you about. Obviously, looking after our childhood teeth really has a roll-on effect on how, our little one's development. So my next question is, how does oral health connect to things like feeding, speech development, sleep, emotional regulation, all of that kind of stuff?
Yes, yeah, that's a very good question there because um, there are lots of points when it comes to that. So, oral health, we tend to think of oral health just about teeth and gums, but there are other structural parts of the mouth that influence growth, influence feeding. One big topic nowadays, I believe you see that a lot as well, is tongue tie. And we know that there's been some changes with genetics and methylation and other things that influence how the incidence of tongue ties. So I am not radical about anything. So I think there is a place for different approaches depending on the circumstances. So one thing when it comes to tongue tie, just I'm not sure how much your audience understands that. So I'm going to go back to the basics a little bit. The tongue serves as a tool to expand the jaw. So think as a tiny pressure that's put. Ideally, the tongue should be sitting on the roof of the mouth to start. So it's a lot of people believe that on the floor of the mouth is the proper posture for the tongue, but in fact, it's the roof of the mouth for a few different reasons. One, because the tongue touching on the roof of the mouth helps with that gentle pressure to expand and grow the jaw. Kids are very plastic, so they mold very easily with pressure. It sounds even funny saying that, but it's the bone is very soft, and that pressure will really help things grow. So with the tongue sitting on the roof of the mouth, there's more expansion, more growth happening to allow the space for better breathing, because the roof of the mouth is also the floor of the nose, and also for more bone growth for teeth, for adult teeth to fit in. The other thing is that we have one of the main nerves of the parasympathetic nervous system, which means we have the sympathetic nervous system, which help us run from the lion and have that fast response, more stress related response, which is necessary. And then we have the parasympathetic nervous system, as you know, that help things to settle down and for us to go back to balance. So one of the ways to activate the parasympathetic nervous system and to soothe ourselves and to go back to this balanced state is by touching the tongue on the roof of the mouth. So we activate that nerve and the whole circuit closes. So we also see a lot of yoga practices that say pressure on the tongue, with the tongue on the roof of the mouth, just to create that whole connection with the parasympathetic nervous system to calm the body down. So when it comes to behavior and seeing kids' response, we tend to see a more sympathetic, more alert response from children when they mouth breathe, because the tongue is often sitting on the floor of the mouth, which with the pressure opens the mouth. There are a lot of factors that should be investigated. I don't want to make this a super simple topic, but in a nutshell, it's really the posture of the tongue influences a lot of things. So, yeah, the other thing, Clarinda, that I think a lot and I talk a lot about with parents is diet, because we live in a processed mode, in a processed diet era. And as you know, there's not a lot of chewing happening. And if we don't chew enough, we don't exercise the muscles here. So there's not enough contraction and relaxation of the muscles, which ultimately also influence growth and breastfeeding and a lot of things that are influenced by how the lower third of our face develops from childhood. Yeah.
Yeah. That is so interesting. I've never actually heard of that before. I have heard of the putting your tongue on the roof of your mouth to connect to the parasympathetic nervous system. Because like when you're in pain, as an example, like as mums when we're getting like eyebrow waxes or whatever, I was always taught put your tongue on the roof of your mouth and it actually helps put you in a calmer state and you don't actually react to the pain as much. So that is actually very interesting in a way that you put it and how it connects to, I guess, our little ones' oral health as well. As a child and family health nurse, obviously, when we're doing, I have my blue book here because it's something we talk about all the time. When we're doing our developmental checks with little ones, we're always talking about oral health, and it's from such an early age, because if we're educating our families on how to take care of their little ones' teeth before they've even actually erupted or come through, we're really setting them up in the future. So things such as like, you know, using like a little like rubber toothbrush or something like before teeth have even be erupted, so they can get used to the sensation of actually brushing their teeth. And obviously, I'd love to touch on this in a little while with you, but when to actually start using toothpaste, and like, do we just use water to start off with when teeth first come through? Like, what kind of toothbrush do we use? Like, we're always having these conversations with our family because it does have that roll-on effect to ensure that our, you know, we have that foundation for our adult teeth. And when we're doing our checks as developmental nurses, like we're looking for like signs of decay really early on, like if there's white spots on the teeth, and how we can, you know, get that early intervention if need be. So again, we're setting them up for, you know, the foundations of their adult teeth. So it's something we really like to focus on as well. And then obviously tooth development can have a really roll-on effect with speech and talking and reading and writing. And it's just that you sometimes you just have to come back to those basics, really. really have to come back to those basics. But that was a really interesting topic that you just spoke about. Um, I really love to test, I guess, your knowledge base around common signs in children that parents usually often might overlook or they're told is normal and they shouldn't be ignored. So I guess yeah, common signs in children that parents are often told are normal and actually shouldn't be ignored. I would love to know your wisdom around that.
Look, there are a few, but the ones that I'm going to mention here first is snoring and waking up tired. So for kids, and even for us adults, we should wake up fully re-energized. It's not physiologically normal. It's not what should be expected for us to wake up and still feel tired. Obviously, if you had a big night or for whatever reason you had to wake up in the middle of the night, obviously that there are exceptions, but that shouldn't be the rule. So what I see, and I educate a lot parents around, is snoring for kids is a topic that really you need to pay attention and how your child is waking up, how agitated they are during nighttime. Because we know that sleep apnea, which means when the child, and same for adults, but talking about kids particularly here, when they stop breathing during nighttime, it's really a big red sign there. There's a big alert. We know that obviously we need to breathe to live. And if that oxygenation and the gases inside the body are not well balanced, there is a real concern there. So that's the first thing. We need to pay attention to our kids. Are they snoring too much? Is the sleep too agitated? Are they grinding a lot? Because grinding, it's also another sign that something may not be right.
Mm.
Um, just on the topic of grinding, I'm not sure how much you see that with the people that come to you, but there is an extent of grinding that all kids go through that it's acceptable. But when there is a lot of grinding happening, one of the signs, it can be a silent sign of sleep apnea. So the child is having difficulty breathing because it's natural. If you look at me here, like if I move my jaw forward to grind, uh, I'm automatically opening my airways. So sometimes kids grind and adults to bring the jaw forward so there's more space for the air to go through. So that can be a big sign of that.
Mhm.
I had also this conversation with a doctor and we disagreed. So there are divided opinions on that, but it could be, and I think that there's no harm in testing when it comes to grinding. There could be some signs of parasites as well. Some doctors disagree, but when I look back and at Ayurveda and other ancient medicines, we see that correlation a lot. And I have to say that I see that in my practice because I often tell parents, let's just rule that out. Let's just check for parasites. If they are, we address them. If they aren't,
Yeah.
we look at other causes. Stress for kids is also real nowadays. They get a lot of dopamine hits with all the tech that we have, or the iPads and the stimulation. So their nervous system becomes more stressed. So we tend to see more grinding, but it's not something that should be ignored. So just going back to your question, I think snoring is a big one. The agitated nights are very important to be investigated. And the same thing with clenching and grinding for kids. This should be really looked at. The third thing, more related to teeth and gums, is bad breath for kids. We do see some kids that wake up with bad breath, and that's not super concerning, but they shouldn't have bad breath constantly along the day. That is telling us that something is not right. Either diet or the type of bacteria that they have in the mouth it's out of balance. So that also needs to be looked into. And
Amazing.
the presence of decay. Oh, Clarinda, yes, I can talk so much about this. Yes, the presence of decay for young kids is also,
An
oh,
early sign.
yeah, it
Yeah,
is
of
a
course.
disease. Yes. Yeah.
Yeah, of course. Oh my gosh, of course. Not many people know that these are definitely signs that should not be ignored. And I 100% agree with the snoring and the mouth breathing. A lot of
Mm.
people come to me for sleep support, and their little ones not sleeping, they're not napping during the day, they have terrible sleeps overnight, split nights, waking up every 1 to 2 hours. And the first question that I usually ask the people or the families that I work with is your baby a mouth breather and do they snore? Because that if they have those two things, I can always pinpoint it to it being something medically underlying that
Yeah.
actually needs to be investigated further beyond the scope of what I can do as a child and family health nurse. And
Mhm.
usually I find it's connected to the mouth, it's connected to the oral health, or sometimes it's actually connected to our adenoids and tonsils. A lot of the time, mouth breathers I find, and little ones that snore as well, they have actual large tonsils, large adenoids that actually are affecting their sleep. And then it has a roll on effect. And then it's affecting everything from our oral health to our sleep to our eating, feeling agitated, our emotions. And yeah, these are definitely something that should not be ignored and definitely need to be spoken about more in today's world. But they're just not, because a lot of people are like, oh no, it's just normal. But obviously, we're here to make an impact and talk about these topics so much more. So thanks so much for bringing that up. The next question that I would love to chat with you about, which we spoke a little bit about before, about like toothpaste, fluoride, and all of that kind of stuff. But at what age should parents really start thinking about that preventative, I guess, dental health, such as brushing their teeth? When do they start brushing teeth? When do they start using toothpaste, flossing? When should they start attending a dentist? All of those kind of things. What should parents look into?
Yes, Clarina, just before I answer this question, I'm going to go back a little bit, if it's okay with you, about the adenoids and tonsils that you just mentioned, because I think that's I love how holistically you think there. One thing that I always talk to parents, obviously it goes beyond my scope of practice. We need to see an ENT and we need to have things investigated. But if we have mouth breathing, there's no filtration happening, so the air comes in just as is. So lots of bacteria, mold, viruses, dust, everything goes through the mouth and straight to the tonsils, which become one of the first areas of defense of the body. So, and then we start seeing a lot of enlarged tonsils. So addressing nasal breathing is really, really important. I don't like jumping, and I love when I have some ENTs that I refer my patients to that will look at those things before deciding to have the tonsils, adenoids out. And I think there is a place for everything, as I mentioned before. There are times that we need to intervene, but there are times that can we address breathing first? So then the tonsils are not so flared up because they're working as the first defense from the body. So just wanted to make this comment to help people think and question a little bit more and make better decisions for their kids. As I said, there's no black and white answer when it comes to health. It's a very individual approach, but just let's start looking beyond. Now, going back to your question in relation to the toothpaste, it's really, really important to start cleaning the baby's mouth as soon as they come to the external environment. So as soon as they're born and they start feeding, we should start cleaning gently, just damp cloth, water, and no, we don't need any chemicals or any external cleaners or toothpaste at this stage, just water and just disrupting that plaque that will sit on the roof of the mouth, on the cute gums. And so just cleaning everything is really, really important. And then when we start seeing teeth, it's important to start brushing, either with those little finger brushes or with age-appropriate brushes. Nowadays, we have a great variety on sizes, always going for the softest toothbrush that we can get. Most of the time, they're soft for kids. And then just cleaning, disrupting the plaque is the most important thing. So I'm not a big advocate for specific toothpaste unless there is a need for certain recommendation, and we have great toothpaste nowadays that I recommend, but not for that age. If we want to have a little flavor, then yes, let's look for a toothpaste that's appropriate for the age. Normally, up to 5, 6 years old, even the most mainstream toothpastes won't have fluoride in them, because when the child is not, it doesn't have the skills to spit out, it's a big no-no for fluoride, a fluoridated toothpaste. So definitely go with the most natural ones, or even the Oral-B Colgate will have the alternative without fluoride according to the stages or the age that the child is in. When we have teeth in place and the child is older and they can spit out, I am still not advocating for fluoride. One, because we have fluoride in a lot of other sources. So sometimes, depending where we get our veggies from, if they've been watered with fluoridated water, there'll be some fluoride there. So we have this cumulative effect on fluoride in the body and in our system, in everything around us, depending on the water filtration, if there's any water filtration at home, or depending on the area where you live, there might be some fluoride in the water as well. So I'm not an advocate for fluoride in toothpaste. And on top of that, I advise to have fluoride removed from the water, just because of a lot of studies have shown big correlation with fluoride and IQ levels and endocrine system response, so thyroid response, and a lot of other things, fertility and other things. So I don't really recommend fluoride. Going back to your question, I like a toothpaste with hydroxyapatite for kids. And nowadays, here in Australia, we can find that very easily. Go to your closest health food shop and you can get one either for kids or adults. Remember that the amount of toothpaste, regardless of the toothpaste that's being used, has to be a pea-size amount. It's just a little bit. We don't have the need of putting a lot of toothpaste on the toothbrush. It's just a little bit. The main effect of brushing doesn't come necessarily from the toothpaste that's being used, but from the mechanical movement and disturbing the plaque there. When it comes to flossing, I tell parents, start flossing as soon as they have those back teeth. So usually around the age of 3, start flossing. You floss your kids' teeth. When they start going to school around 5, 6 years old, let them play. Nowadays there are those small little flosses that come with a holder. That parents can use, and kids can play around with that too, just to have a feel of it. And the same thing when it comes to brushing. Parents should brush all the way to the age of 7, 8, and let the kid brush as well. So let them start the job and then the parents finish. Ideally, say, make that like a family time event. Let's everyone brush their teeth. So parents brush with the kids, and it becomes a little bit of like a role model. They watch parents brushing and then they do them. It becomes a little bit of a play, but it's also a strong habit that's been developed there.
It's amazing. I love that. And I don't know if you mentioned this, but like what age would you start using toothpaste?
Toothpaste. So when we start having teeth, we can start using age-appropriate toothpaste. So yes, as soon as it varies a lot with kids, but I would say around the age of 2 years old, you can start brushing. And the same thing with the first dental visit. I normally advise 2 years old, take them to the dentist, start, playing on the chair. It's sometimes it's hard for us to do something or even to examine the child, but just making them comfortable in the environment is really, really important. But yes, I would say around the age of 1, 2, depending on how many teeth your child has, but there's no harm in using a natural or a non-fluoridated toothpaste. Just a tiny, tiny bit, just
Yeah.
for a little bit of flavor. Yeah, once
Yes.
teeth comes through.
Yeah, we
Yeah.
usually recommend from around 18 months, 2 years to start use toothpaste. Before that, you can just use water and a soft toothbrush. And we always recommend, exactly like you said, dental visits, even if it's just for familiarity, just to get them familiar what a dentist does, what it looks like, what the room looks like. And obviously doing more regular visits as they get older, just to check, how everything's going as well.
Yeah, no, I love that advice. That's exactly what we say. Yes.
Amazing. Just to tie everything up, if there was, I guess, one message that you could leave parents today in regards to their little ones' oral health, what would you want them to know?
The one message first, the first thing is like there's no guilt around anything. If you've heard something new today, start implementing, do a little bit of further research. Don't feel guilty from your previous choices. So we always do the best that we know for our kids. Second, know that you can question things, that you don't need to accept everything that's said to you, but make educated decisions on what you know it's best for your child, and then be open-minded to learn new things as well. But the number one thing is, there's so many, but one thing is don't transfer your dental traumas to your child. So sometimes I see parents that come in and they are scared of the dentist, and they like, you can feel the tension in the air. So then the child is afraid because why my mom is afraid. So um and then have good habits at home. Make this a part of your routine and a part of the routine of your kids, so they learn that looking after themselves is the basic. It's not a super skill. It's the standard. So set the standards right when it comes to hygiene, to diet, to all the choices that we have, and be the role model for your child.
Amazing. Beautifully said, Maria. And where can everyone find you? Where can they connect with you and learn more about what you do as well?
I have a podcast as well. It's called Mind Your Mouth. Mind Your Mouth. I'm on YouTube, Spotify, and Apple Podcast. Our practice is at Casuarina in the Northern Rivers of New South Wales. And yes, I can send you my website, and if yeah, we can put it on the comment notes.
Amazing. Show notes.
Show notes. I'm like, wait a minute, did I see something wrong here? Yeah, on the show
Amazing.
notes. Yes.
I will
Yeah.
share all of the links and all of the details in the show notes so you guys can all connect with Maria and learn more about what she does. But thank you so much for sharing all of your wisdom, coming on the show today. If this episode resonated with you, I encourage you all to share it with other parents who might need it, who might need some help and education as well. And as always, trust your instincts, go with your gut. And as Maria said, don't hold on to that guilt as well. You know your child best, and we're just here to help you along the way and support you in your journey. And don't forget to subscribe, follow Maria along, and thank you so much for listening, and I'll see you guys in the next episode.
Thank you, Clarinda.